First question, and most important, is to explain the financial support that kicks in the second week of lockdown. That really matters in Sydney.
Well, there's obviously business support and there's income support. Now, business support was decided by National Cabinet to be provided by state governments, and we've seen that in Victoria and we're going to see that in New South Wales. When it comes to income support, the federal government has said that it will provide a payment as long as the lockdown goes for more than 1 week and as long as those areas subject to the lockdown coincides with the Commonwealth hotspot definition as defined by the Chief Medical Officer. And that is what is applied in New South Wales. So as long as that lockdown goes for longer than a week, those people who have lost more than 20 hours a week of work will be able to receive $500 from the federal government. Those who have lost less than 20 hours a week will receive $325 a week from the federal government. That is money that will be paid through our welfare system. Obviously, you have to apply and meet all those eligibility requirements, but that money will be available once the lockdown extends beyond that 1 week initial period.
We've had a multi-week shutdown in Melbourne. There's a couple of week and most likely multi-week shutdown in Sydney. There could be short, sharp in Brisbane. Something's happening in Darwin. South Australia is locking itself off from the rest of the country and introducing business restrictions, despite the fact there's 0 cases. And there was the freak out in Western Australia off just 1. It feels like we're on a mouse wheel here, mate.
Well, these are challenging times, and it's a reminder, Paul, that the virus is still with us. What we have seen across the country over the last 15 months is that we have successfully suppressed the virus, and there's been no better performance than that by the New South Wales government that have avoided those statewide lockdowns, even when they've had cases, for example, in the northern beaches. So I have confidence in their health system in New South Wales that they can get on top of the virus, although we're now dealing with the more contagious Delta strain, which is more difficult and more dangerous. And so that is the real challenge. But again, Australians have done it before. They'll do it again. They'll get on top of this virus.
All right, let's turn our attention to the intergenerational report, which is around. This is fascinating reading, but put simply, yes, there's going to be an awful lot more people in Australia decades from now, but without an increase in the number of people being born or the number of people being flown into the country, it's going to end up being a much older population.
Well, this is a report that comes out every 5 years. It was an initiative of Peter Costello, and it looks at the demographic and economic trends, but it's based on existing policy settings. And of course, over a 40-year period, Paul, those policy settings will change. What this IGR tells us is that Australia will continue to grow and that our debt, while it increases as a result of spending through the COVID pandemic, it is still low by international standards and it can be sustainable. But there are some warning signs. The ageing of the population is one, because that puts added pressure on expenditure, particularly health and aged care expenditure. And on the revenue side, when you have an ageing population, you have less people of working age for everyone of non-working age. And then the other thing that comes through in the analysis in the intergenerational report is that our population will be smaller than what was initially expected back in 2015. And that's because the closed borders have seen less people come to this country, and we don't make up that lost ground in the years ahead. And migrants tend to be younger than those across the existing population. So as a result, you have a smaller population and you have an older population than we were initially expecting before COVID hit.